Hi and welcome to Medicine Past, Present and Future. My name's Dr. Nick and I'm the past.
And my name's Dr. Isabelle and I'm the future.
And together, we're the present.
Now, Dr. Nick, you've got a big birthday coming up this year.
Have I?
Well, do you at least know what this birthday entitles you to?
Well, I've already got my seniors card.
Yeah, no, not that. It's to a government-subsidised influenza vaccine.
Oh, yay! But you raise a good point, Dr. Isabelle, because we doctors, particularly GPs, we often talk about these things called milestone birthdays, when you turn 20 or 50 or 70 as being particularly important.
Yeah, that's right. And for your 50th birthday, you might even receive something in the mail from the government.
Well, let's wind back and do this in chronological order, shall we? So let's say you're in your 20s. Hopefully you've got your own Medicare card, you've got your own GP. Now, what are the sort of health checks that someone in their 20s should be looking for?
So for people with a cervix, age 25 is when we start our national cervical screening program. And if you're low risk, you only have to do it every 5 years.
Now, this is a big change, isn't it? Because it used to be every 2 years.
So it's much more straightforward now. Other things to look for in your 20s and 30s, STI screening and contraception discussion if you're sexually active, blood pressure checks for pretty much everyone, and anyone who's thinking of having a baby, preconception counselling.
So it's really important, even if you're a healthy 20-year-old, you still need regular health checks.
So, Dr. Nick, let's just say I've gotten through my 20s and my 30s and I've turned 45 and I turn up at your clinic and I want a general checkup. What does that entail?
Well, it's not going to be done in one consultation because I'm going to ask a lot of questions, I'm going to do an examination, and I'm going to order some tests. And at the very least, I want to know what your blood pressure, your cholesterol and your sugar are. And then, depending on your family history, your own past history, I might want to do skin checking, prostate checking. There's a whole lot more that we might need to do. But Dr. Isabelle, why don't you tell us what that 50th birthday present is from the government?
Yes. So this is the National Bowel Cancer Screening Program. Now, bowel cancer often starts as small polyps, which can be really easily treated, but the problem is they're mostly asymptomatic. There are no symptoms. The test itself, it looks for tiny particles of blood in your poo, which can lead to an earlier diagnosis and therefore earlier treatment.
But only about 40% of the Australian population who get the kit actually use it. So if you've got one sitting on the shelf at home, make sure you get it down and do it.
And for women in their 50s, it's time to start thinking about mammograms if you haven't already, as well as things like bone health for everybody else. Now, Dr. Nick, why don't we talk about your birthday present, vaccines?
Yes, once you turn 65, you get a free government flu vaccine. And at the age of 70, you get a vaccine for the shingles and pneumococcal, and they're also free.
Now, of course, there are many other reasons to see your GP, and importantly, mental health issues can occur at any age and any stage.
Which is true, Dr. Isabelle, but you talked about sexual health as if it stopped when you were 30.
Yeah,
It does go on after you're 30, you know.
I think we'll just leave it there for today, Dr. Nick.
All right, Dr. Isabelle, thank you very much.
Thank you very much.